Hi guys, welcome back to Doc. My name's Shane and I'm a final year medical student and neuroscience supervisor at the University of Cambridge. Today we're going to be talking about how best to approach the start of your clinicals. So those were the 4 goals that we're trying to achieve right from the start of your clinicals. So how do we go about doing this? I'm now going to suggest basically a stepwise approach for you to follow in order to help you in your way of achieving these 4 goals. So, step 1. I think it's important to start by learning how to take the good histories and learning how to perform good clinical examinations. The place to start in order to help you do that would be Geeky Medics. It's a fantastic website. It has very good written guides as well as very good videos that run through clinical examinations. So it's basically the place that I started when I started off at clinicals, and it was fantastic. I got very proficient at performing clinical examinations and very confident at knowing what stages and what steps were involved in each examination. So that would definitely be the first place to start. However, clinicals isn't just about books. You also need to develop very good patient skills, empathy, learning very good patient manner. So yes, you need to know how to take good histories and how to perform a good clinical examination, but you can only really do that in the real world and real life by practicing. And yes, you can practice on each other, but it's just not the same as doing it on patients. So it's very important for you to put what you learn in your own rooms, in the classrooms, into practice. So it's very important to go into the hospital, go into clinics, go into wards, meet patients, take histories from patients, do full clinical examinations. I'd recommend doing a head-to-toe examination and present the findings to a doctor. And it's very important to do this last part because when I started, I was literally just taking a history from a patient, examining them, and then, right, felt really good, okay, cool, I did something, and then I'd go home. But it's very important for you to stop, wait for a doctor to become free, present to them, and then ask for their feedback. You know, is there something I missed? Should I have done something differently, etc.? Get some good criticisms that are going to be constructive and going to help you improve yourself. Which brings us on to step 2. So, it's now important for you to learn how to work as part of a team and also get used to this clinical setting. You need to basically go through a learning process again and learn how things work around a hospital. So learn how clinics work, learn how wards work, what's a ward round, what time do they start, how do they manage patients when they come to the ward, how do patients get referred to clinics, etc. So ask plenty of questions, talk to everyone, so talk to doctors, both very junior doctors like FY1s, all the way up to consultants, talk to nurses, talk to phlebotomists, talk to the healthcare assistants. Every single person in that team brings something to the table, so talk to them to find out every little piece of medicine, because the way medicine is going is it's providing holistic care to the patient, and it's important for you to know exactly what each team member does and how they contribute to patient care, because that's going to make you a better doctor when you have to take care of patients yourself. So that was step 2. Step 3 is developing a very good diagnostic process or framework. So I'd recommend 2 main resources. One would be the Oxford Clinical Cases in Medicine and Surgery. That's a red and white textbook. It's very, very easy to read, and it's probably the main resource that I used throughout my first year at clinical, and it's fantastic. The way it's laid out is so intuitive. It works through a presenting complaint and it runs through a differential list, then it runs through what important points in histories that you need to ask and look out for, as well as what clinical examinations you need to perform, what investigations to order, what all of those things will look like for each main diagnoses, and then it has like a few short cases that basically presents other diagnoses that it could have been. And it's a fantastic way to learn medicine and surgery, and that's probably the place to start at the beginning of your clinicals. You should supplement that by also watching Osmosis videos on clinical reasoning. So Osmosis is essentially a website that's great for visual learners. It has loads of videos about essentially everything to do with medicine. I can't recommend this site more. It's fantastic, and it's so easy to watch. It's very well narrated, and the animations are great. Honestly, I wish I discovered it in my undergrad, because I would have used it all the way throughout. But yes, it's fantastic for learning clinical reasoning, and definitely use that to supplement the Oxford cases in medicine and surgery. So that was step 3, which brings us on to step 4. This is the point where you need to start brushing up on your pathology and start learning about the conditions. So what I mean by that is learn the basic pathology of that condition, learn the basic management plans, and where do you go to do that? So I would recommend the Past Medicine textbook, which essentially is a no-nonsense, need-to-know list of everything you need to know about that condition. So that goes from how a patient might present, so what symptoms and what signs to look out for, and it also runs through the basic investigations you might have to do and management plan. So it's fantastic, no nonsense, straight to the point. At the same time, you should also watch Osmosis's videos on pathology just to get a good understanding of what that disease or condition is, because that's how you become a really, really good doctor. So that was step 4, which brings us on to the final step, step 5. And unfortunately, this is the part we have to start talking about exams. And these aren't the clinical exams that I was talking about. These are the final exams you do at the end of your first clinical year. So that would include usually 2 parts. OSCEs, which are known as essentially objective structured clinical examination. So knowing how to perform cardio exam, resp exam, abdo exam, etc., because you're going to have to do them on patients or actors. So that would be the kind of practical part of your final exam in your first year. The other component would be a written exam. Essentially, it's an MCQ, multiple choice question, and often in the style of an SBA, which is a single best answer. So what that means is they'll ask you a question, and then a list of 5 different options are available. And basically, the whole concept of single best answer is all of those answers are correct to some degree, but you have to pick the one that's most correct. And Past Medicine is a really good place to start there. It has a very good and very huge bank of past MCQ questions or SBA questions, and it is a fantastic place to start testing yourself. And it has a very good algorithm to make sure that you retain everything that you learn, and also make sure that you learn from your mistakes, because it will retest you on concepts that you didn't basically get correct first time round. And the algorithm is great, it's fantastic. Make sure that you do learn and you are progressing. So it's very important for you to, even from the beginning, get used to how you're going to be examined. So you definitely should start Past Medicine as early as possible. So that has been a quick summary of how best to approach the start of your clinicals. Hopefully you guys have found this very useful, and if you have, please like, share and follow. Make sure as many medical students as possible knows about what we're trying to do and makes use of us. But that's it from me for today, and I'll see you guys next time.